What is pneumonia? Pneumonia, an infection that affects the lungs. It happens when germs like bacteria, viruses, or fungi enter the lungs and cause the air sacs, called alveoli, to fill with fluid or pus. This makes it hard for a person to breathe properly. What are the symptoms of pneumonia? The symptoms of pneumonia can vary, but common ones include cough. You may cough up mucus, phlegm, which can be yellow, green, or even bloody. Fever and chills, a high temperature, sometimes with chills or shaking. Shortness of breath, it may feel like you can't catch your breath, even when resting. Chest pain, this pain can get worse when you take deep breaths or cough. Feeling very tired, you might feel unusually weak or tired. Pneumonia symptoms can be mild, like a bad cold, or more serious. If it gets severe, you might need to go to the hospital. What causes pneumonia? Pneumonia can be caused by different germs. 1. Bacteria. This is the most common cause of pneumonia in adults. Bacterial pneumonia can come on quickly, with a high fever. 2. Viruses. These include the flu virus and COVID-19. Viral pneumonia tends to develop more slowly and may not be as severe, but it can still be dangerous, especially for young children and older people. 3. Fungi. This type of pneumonia is rare and usually affects people with weak immune systems, like those with long-term illnesses, or who take certain medications. Who is at risk of getting pneumonia? Anyone can get pneumonia, but some people are at higher risk. Babies and young children. Older adults, especially over 65. People with other health problems, like asthma or diabetes. Smokers, because smoking damages the lungs. People with weak immune systems. How is pneumonia treated? The treatment depends on what caused the pneumonia. Bacterial pneumonia is treated with antibiotics. Most people start feeling better within a few days, but it's important to finish all the medicine. Viral pneumonia usually improves on its own, but rest, fluids, and sometimes antiviral medications can help. Fungal pneumonia is treated with antifungal drugs, but this type of pneumonia is less common. For mild cases, rest, drinking lots of fluids, and taking fever-reducing medications like acetaminophen or ibuprofen can help you feel better. Can you prevent pneumonia? Yes, there are steps you can take to reduce the risk. Get vaccinated. Vaccines can protect against some types of pneumonia, such as pneumococcal pneumonia and the flu, which can lead to pneumonia. Good hygiene. Wash your hands regularly to avoid spreading germs. Healthy lifestyle. Avoid smoking, as it weakens your lungs and makes you more likely to get pneumonia. Eating healthy, staying active, and getting enough rest can also keep your immune system strong. When should you see a doctor? If you have a cough that isn't getting better, a high fever, chest pain, or trouble breathing, it's important to see a doctor. Early treatment can prevent pneumonia from getting worse, especially if you're in a high-risk group. Pneumonia is treatable, and with proper care, most people recover in a few weeks. However, in severe cases, it can lead to complications, so it's important to take the symptoms seriously and seek medical help when needed. What is pneumonia? Pneumonia, an infection that affects the